Welcome to RelapsePreventionPlan.net's free online rehab lessons. We believe that it's never too late to learn to prevent relapse. Welcome to this presentation on sex and relapse prevention. In this presentation, you'll learn to describe how self-esteem and sexual activity are related, to list 3 of the impacts of alcohol and drugs on sexual health and 2 actions to increase sexual safety, and to describe 5 boundaries that promote intimacy and 5 violations of intimacy boundaries. Sex is more complicated than ever. We worry about whether we are gay or straight, if we have contracted or spread sexually transmitted diseases, if our sexual desires are normal or abnormal, whether we should act out our sexual fantasies, and what we have or have not done sexually when intoxicated. Sexuality is capable of bringing pleasure and relaxation, heights of ecstasy, a sense of intimacy, and it's also capable of bringing distress, frustration, and disappointment. Sexuality is complex. It's intricately tied in with our emotions, our mind, and even our spirituality. Our expression of sexuality is related to our history, our belief system, our body image, our deepest secrets, our basic sexual nature, emotions of fear, anger, and pain, and a need for and fear of emotional intimacy. Self-esteem and sex. When self-esteem is low, we tend to get involved with sexual partners and sexual practices that reinforce our poor image of ourselves and leave us with less self-esteem than we had before. Promiscuity, prostitution, and sexual addiction are linked to low self-esteem. These behaviors perpetuate low self-esteem by causing isolation, shame, and humiliation. Very often, when we reach success, we find ourselves disappointed. And that's when you try to fill the hull, the void, with drugs or illicit sex. What I've realized is that nothing outside of yourself can make you feel whole. Self-esteem and sexuality are linked. Self-esteem affects sexuality, and sexuality affects self-esteem. It is not only our body that can turn another person on or off, it is our entire person, mind, personality, and spirit that attracts another person. High self-esteem causes us to feel more attractive, desirable, and confident about our sexuality. When we feel good about our sexuality, we are connected to a part of ourselves that can provide a tremendous source of energy and pleasure, and an outlet for stress and tension. Alcohol abuse and using drugs before sexual encounters stops clear thinking and good decision-making, makes talking and listening more difficult, makes it harder to assess and leave potentially dangerous situations. It increases aggression and impulsiveness. It decreases manual dexterity, so it is more difficult to use a condom or another barrier method correctly. Alcohol and sex. Too much alcohol numbs the nerve endings in both male and female genitalia. It decreases female lubrication and can lead to painful sex. It affects the rational processes of the brain, increasing likelihood of higher risk sex practices. And it increases expectations for the sexual experience, but decreases desire, arousal, and satisfaction. And in large amounts, alcohol may reduce the effectiveness of low-dose oral contraceptives. Provokes the desire, but takes away the performance. When people of average weight drink more than 2 beers, cocktails, or glasses of wine in an hour, the alcohol interferes with erection in men and impairs sexual responsiveness in women. Drink too much, and all you'll do in the prone position is pass out. Prolonged drinking and sex. Prolonged drinking of alcohol in men reduces sexual behavior as the liver is stimulated to produce a substance that increases the destruction of the male sex hormones. It results in withering of the testicles, enlargement of breasts, loss of male distribution of hair, and impotence. Many unwanted pregnancies occur when partners are too intoxicated to use contraceptives. Tobacco and sex. In men, smoking narrows the blood vessels, reduces blood flow to the penis, and increases risk of weak erections. In women, smoking narrows the blood vessels, limits blood flow into the vaginal wall, and decreases lubrication. Prescribed antidepressants and sex. Most have as side effects loss of desire and difficulty reaching orgasm, impaired erection, and lubrication problems. Check with your doctor about going drug-free from Thursday morning to Sunday at noon for better sexual desire and functioning over the weekend. Remember, check with your doctor first before making any medication changes. Illicit drugs and sex. Narcotics and tranquilizers are downers, and they reduce the sexual interest of people who use them. Amphetamines and cocaine stimulate sexual desire but impair orgasm, making sex very frustrating. Common sexual problems. Heroin and morphine often cause sexual problems. Nearly 50% of male addicts report impotency, and many female addicts do not experience orgasms. All report low levels of sexual interest. Similar problems are reported by crack or freebasing cocaine users. Marijuana and sex. The result is unpredictable. Some say it enhances lovemaking as it increases blood levels of phenylethylamine, a neurotransmitter associated with love and lust. Who knows if I said it right or not? Yet marijuana makes some people withdraw socially or become anxious or irritable, which does not enhance sex. Sex, injection drugs, and power. Gender power imbalance is seen with initiation to injection of drugs. Males gain control of the initiation by directly injecting females after first injecting themselves. Frequently, females fail to learn how to inject themselves and become injection dependent on other injection drug users, often requiring help to inject throughout their injection use. As a result, females feel that they do not possess the power to insist that injection equipment not be shared or be cleaned between users. Sexual partners share injection equipment. Females are more likely than males to share injection equipment with their sexual partners. They believe sharing with their sexual partner confirms or creates love, trust, and intimacy. They desire to maintain an emotional connection with their partner. Instead, they confirm their subordination and powerlessness. Drugs and safe sex. Gender-based power imbalance is also seen in sexual relationships that require the adoption of risky sexual behaviors. If the male decides to not use a condom, the female often agrees because she feels she does not have the power to object, and because she wants to confirm or create trust and intimacy in the relationship. Risky sex and injection practices. Studies confirm a link between adopting risky sexual behaviors and engaging in risky injection behaviors. Once a drug-using couple starts unsafe sexual practices, they are more likely to share injection equipment because this behavior is seen to be a similar level of risk, or because it is seen as too late. Sharing injection equipment is far riskier than engaging in unsafe sex in terms of contracting hepatitis C virus. You have problems managing sex, drugs, and alcohol if you regretted sex the morning after because you drank or used drugs the night before, worried you might be pregnant or became pregnant because drugs or alcohol made you careless about contraception, became sexually involved with people you would not choose as partners if you had not been drinking or using drugs, or were unable to remember what happened the night before, or were unable to perform sexually or to enjoy sex after drinking or using drugs. So reduce your risk. Continue staying sober and build your relapse prevention plan. Ensure you and your sexual partner get a full screen for STDs. Get knowledgeable about STD transmission. Get knowledgeable about the forms of protection and their limitations. Stopping using can be a confusing time for sexual relationships. You may have reduced sexual desire. You may feel that you have to address your feelings and sex history before being able to engage in sexual relations. You may want to time out from intense relationships. You have the right to take it as slow as you figure out your values and let yourself recover physically and emotionally. Take it as slow as you need. Sexual desires can return very strongly, and you can make the mistake, and you can mistake the return of sexual feelings and desire for feelings of love or relationship intimacy. You can suddenly think this is the person for you. You or your new partner can have sexually transmitted diseases that are not showing symptoms. Decide what level of risk in sexual relationships you are willing to take, and then take precautions accordingly. Guidelines for safer sex. Alcohol and drugs impair your decision-making ability and leave you very vulnerable to acquiring an STD. Some people feel uncomfortable in social situations unless they use alcohol or drugs. Reduced judgment from drinking or using drugs results in doing things you would not have done if you were not intoxicated. So take the time to assess your feelings and work issues through before beginning a new relationship. You must decide when it's right for you to have sex. Do not allow yourself to be pressured by a partner, peers, or media. Abstinence is recommended when one or both partners are being treated for a sexually transmitted infection. So practice monogamy or limit the number of your sexual partners to dramatically reduce your likelihood of acquiring an infection. Testing for sexually transmitted infections will allow both you and your partner to know if either one of you is infected with STDs and to deal with it before you become intimate. If you are sexually active and have regular checkups, have regular checkups, whether or not you are symptom-free. Become informed, because people who are informed about STDs and how to prevent them generally act in ways that keep themselves safer. Find quiet times to talk with your partner about sexually transmitted infections to decrease the likelihood that you will become infected. Avoid trying to talk about it in the 2 minutes before sexual activity. So be informed and communicate. Avoid high-risk behaviors and avoid high-risk partners. If a person engages in casual unprotected sex with you, there is a good chance that they have engaged in casual unprotected sex with others. People who exchange sex for money or drugs are at a very high risk for transmitting STDs. People who have sex with prostitutes have a high risk of acquiring STDs. And any type of sexual contact, whether it's oral, anal, or genital, is a high risk. So know the sexual history of your partner, and when in doubt, use condoms for every type of sexual contact, including oral, anal, and genital. Getting safer. Gaining control over drugs and alcohol will allow you to gain control over your sexual encounters. Have a sexual health checkup before you engage in further sexual encounters. Become knowledgeable about sexually transmitted infections. All sex has risks, so learn about and practice safer sex. But sex is more than sex. Sexuality has meaning beyond the individual act, So take time to find your personal meanings for sex and intimacy. After quitting, you need time to regain physical health, rebuild your emotional health, and establish your own system of values to guide your life and decisions. Setting intimacy boundaries. A boundary lets positive things in and keeps harmful things out. By the limits you set, you protect the integrity of your day, your energy and spirit, the health of your relationships, and the pursuits of your heart. Healthy boundaries are based on clear values and keep us on track. When you violate your boundaries or let another person violate them, your life goes off track and your risk of relapse increases. Intimacy skills. Respect limits set by the other person. Respect reasonable requests. Confront the other person when something they do or fail to do is beginning to have a negative effect on your relationship. Speak up when the other person's action or failure to act feels disrespectful, thoughtless, or uncomfortable. Boundaries that promote intimacy. Express your issues in a timely fashion. Speak as honestly as possible. Express your feelings in a positive way. Make time for communication. Appreciate the other person's expressions of love, and make regular times to enjoy leisure together. Boundaries that promote intimacy. Share physical closeness that doesn't always lead to sex. Chat about the thoughts and events of your day. Listen fully as your partner does the same for you. Maintain sexual fidelity. Don't cheat. When you realize you're heading toward an unexpected change, talk about it with your partner. Make important decisions together and negotiate as necessary. When your partner does something that improves your life, respond with something that gives them joy. Violations of intimacy boundaries include refusing to discuss important matters, making a decision that affects the other person's life without discussing it with them, staying physically separate, gratifying yourself sexually without consideration of the other's sexual needs or limits, treating the other person coldly or angrily rather than handling conflict directly, rage, refusing to acknowledge how you may have hurt the other person, and not making amends for your mistakes. But you can get your intimate relationships back on track. Use the communication skills in the Feeling Good Handbook and PeopleSmart to communicate your boundaries and your feelings. Boundaries can help put you back on track towards intimacy. We become drawn to a person when we behave caringly toward them. We change by taking care of them, and they also change and become more attractive to us. We feel affection grow when we act lovingly towards someone. Changing and learning takes time. Physical intimacy is not a shortcut to emotional intimacy. Emotional intimacy takes time. So set physical and emotional boundaries so other people don't take over your life. Curb your urge to merge with someone. Take time to get to know them. Build boundaries, not barricades, so you can achieve intimacy. Take time and then take the risk of intimacy. Passion is the quickest to develop and the quickest to fade. Intimacy develops more slowly and commitment more gradually still. Here are the references for this presentation. Pause the slides if you'd like to write down and research more. In this presentation, you learn to describe how self-esteem and sexual activity are related. You learn to list 3 of the impacts of alcohol and drugs on sexual health, and 2 actions to increase sexual safety. You also learn to describe 5 boundaries that promote intimacy and 5 violations of intimacy boundaries. Don't forget to complete our free downloadable workbook, Make Your Last Relapse the Last, available at relapsepreventionplan.net. Remember, this video is not a substitute for proper medical care and consultation with your physician or qualified healthcare professional. Don't ignore professional advice or delay seeking treatment based on the information in this video or on this YouTube channel. Thank you for joining us. You can do it. We believe in you, so don't give up.